Bismillahirrahmanirrahim. Assalamu alaikum to all. I'm Dr. Ujjal Hassan. I'm currently working as assistant professor at University College of Dentistry, the University of Lahore. First of all, I would like to welcome all of you and all of the health professionals, particularly who have taken interest in this our first of the its own kind of research methodology webinar, especially focused on in an insight for the health professionals, and the main focus would be the medical and the dental students. I would like to thank the institution leads from both platforms, Professor Muiz A. Beg, Dean University College of Dentistry, Dean and Principal, Sir Gilani, Sir Professor Gilani, Dean Faculty of Allied Health Sciences, uh, with the collaboration of these both institutes from University Institute of Public Health, the University of Lahore, and University College of Dentistry, the University of Lahore, we are able to start this series for the webinars in order to equip the health professionals to be better equipped regarding the research methodology procedures. I would like to invite our worthy speaker for the this webinar. I would like to first introduce him, Dr. Asif Hanif. He's a very well-known biostatistician and a very keynote speaker in the especially known in our country. He has done PhD in biostatistics, and mashallah, he has more than 300 publications in his respective field, um, with a plenty of experience in supervising different platforms, different students at different organizations. Then I would like to share the agenda of our today webinars. Then I will hand over to the respected Sir Dr. Asif Hanif. We will have a introductory session that is currently going on. Then at least 20 to 25 minutes lecture. Then at the end, you can write the question answers in the chat box or the comment box. So one by one, I will ask what the speaker to answer those questions. So like 8:35 onward, we will go for the closing note. So respected Sir Asif, if you can unmute yourself and please continue from here on.
Thank you very much, Dr. Ujjal Hassan Saab, for providing such a wonderful opportunity. And mashallah, a lot of health professionals are here. I would like to thank all of you for taking out the time and coming here for for learning and for sharing your own experience. Inshallah, I will try my best to summarize all the content in the given time because the time is very short. So before wasting any time, I want to start. Please, can you give me right to share my screen? Okay, thank you very much. Bismillahirrahmanirrahim. Today's session is on research methodology and insight for health professional. Dr. Rubijul Hassan has introduced me. I'm Dr. Asif Hanif, Associate Professor at University Institute of Public Health, Faculty of Allied Health Sciences, University of Lahore. Thank you very much for both deans for giving us the opportunity to talk with you people. I just want to ask you people because I'm sure you cannot answer here, but you think, what is research? The research, in my opinion, for you people is only a fear. This is a state of fear for many of us. This is my definition for you people. So here we will discuss few tips, few points to vanish this fear. And I wish after having this session, this fear is minimized and you start publishing your research manuscripts. If I talk about the bookish definition and a definition from the dictionary, there are various definitions proposed by very well renowned authors. Research is a journey of discovery, or this is an attitude to attain your professional goals. This is an experience or method of critical thinking, a careful critical inquiry in seeking facts and figures. Research is a process of arriving at solution through the planned and systematic collection of analysis and interpretation of data. Many a times we are stuck with the facts and figures, we are stuck with the data, and many a times we have everything in very good planning, but we cannot execute to complete our research. So today I will give you some tips how to do and how to publish your research. First of all, you must have to be very clear in your mind that I'm not going to give you very detailed overview of the concept. I'm just giving you the tips so that you can take a step forward to at least plan and execute your research and then to publish your research. Research is actually a movement from the known to unknown. The last definition is very much important and to understand. Many a time we know the things. This is called a literature review, and from this literature review we have the research gap. After identification of research gap, we actually move for the unknown. This unknown is actually your own research question. So whenever you have planned to execute any research, to do any research, here I just want to tell you, you have to be very careful with to know what is existing material or what is existing knowledge. After you know about the existing knowledge, you actually find the research gap, and then after finding the research gap, you can collect data to answer your own research question. Research is an interpretation of facts and revision of the existing theories or laws in the light of new facts and figures. As you all are health professional, you all are medical researchers, and with the passage of time, you see very innovation, very modernization in healthcare system, and these modernization and healthcare system in medicine is actually to revise the existing theories. So this is very much important again to review the existing things, and when you review the existing thing and you see the research gap in context of current era, and you can fulfill that research gap after collecting the facts and figure and after collecting the data, and then you can answer your research question. Traditionally, research is split it into two words, re plus search. This definition of research is found in many books, searching again and again, searching again and again, and a fact that cannot be searched further. Believe me, that that phenomena is actually the constant, and when the things are constant, there is no need of research. So in our practical life, being a medical student, being a health professional, I purely tell you, you cannot say in this area of medicine now there is no need of research. You every time need to explore the things, and you every time, if you know the existing things, and every time you will find the research gap, and you if you need to fill that research gap, you need to design your own research question, then collect data to fulfill your objectives and to answer your research question. Why we do research? We do research for many reasons, like to generate new knowledge. As I just told you, you can generate new knowledge, or you can confirm the existing knowledge. And the research is very much helpful to generate the new knowledge or to confirm the existing knowledge, to get the evidence. This is the evidence that I told you to confirm the existing knowledge. This is very much important to better understand and shift in consumer attitude and the states. If you are food scientist, if you are working in food industry, you can see if there is consumers attitude and taste difference. You can collect data, you can have evidence, and after evidence you can fill those gap after conducting your research. To reduce operational cost, definitely many a times when you are working in a pathology lab, when you are working in dental working for dental materials, and you know that you actually always try to meet the criteria of research that is effective and safe, and all the research product that comes in market, they must have to fulfill the criteria of safety and efficacy. And if we talk about the efficacy, in efficacy, one component is also cost related. So medical research is very much helpful to reduce the operational cost. For example, if you are working in, you are working to diagnose a specific kind of tumor, and you say that this specific kind of tumor is actually diagnosed by a very costly and very time consuming pathological test, and in this regard you have developed a new device, and that device may reduce your time and operational cost. That's why medical research helps us to work for the very efficient and effective tools to be introduced in the market. Research is necessary to enable management to prioritize strategic options for the futures. Definitely, research is very much helpful to cope with the research related issues, and it gives you the solution for the future as well. The concept of 5Ws and H in research is very much helpful again. Like if you know about the basic philosophy of research, it is actually 5Ws and an H philosophy. This 5W and an H philosophy actually works in every kind of discipline in each field of the science. If you see the role of a newscaster, if you see the role of a person who is giving you the evidence, they actually work on this 5W and an H philosophy. Like if you want to know about a specific reason, you must have to answer these 5Ws and an H structure. Like who is involved in the research process? For example, what is the target population, where you want to conduct, why you want to conduct. Actually, you have identified a research area, that's why you want to conduct. What is being conducted, what are your objectives, when you will execute the research or when you will implement the result of your research, and how it is being conducted. Actually, all these things are set in different areas of research. How I have circled, how is actually the methodology, the research methodology. This is very vast field, and this is very much important to be to be understood. Many a times we start research without knowing the appropriate research methodology, and many a times we actually start the research without knowing the research method. So I will share few of them with you in this short period of time. There are two types of research, like qualitative research and quantitative research. Just one thing, keep in your mind that quantitative research is a research that deals with the number, and qualitative research is a type of research. Qualitative research is a type of research that is beyond the number. For example, if you are working to know about the psychological effect of psychological impact of COVID on healthcare workers, there are two types of research to be done. First of all, you can measure this psychological impact. If you can measure this impact, then it is quantitative. And if it cannot be measured, it is in their views, in their discussions, in their attributes, in their characteristics, then it is qualitative research. Qualitative research means it is beyond the number. It will not deal with the number. On the other hand, quantitative research always deal with the number. For example, if you are collecting data regarding age, it is number. If you are collecting data regarding severity of pain, it is number. And if you want to take someone's opinion about some current epidemics, some current topic, and their opinion is in form of their verbals or written form, it is actually a qualitative research. I'll give you a simple example. If I say you can get opinion of 5 health professional regarding the strategies to cope with the COVID-19, and those perception of 5 healthcare workers, if you publish as it they told you, this is actually the qualitative research. Or in qualitative research, you can make the theme, you can analyze the theme, that is called thematic analysis. Here I will put more focus on quantitative research, because because many a times when when you plan to conduct a research that comes in quantitative domain or area. There are few important uh, there are few important content of research writing. And for example, if you want to publish, or if you want to start, or if you want to execute your research, first of all you must know about the title of your research. The title of manuscript or title of your research must have an ability to describe the things to do. It must be self-explanatory and should describe the research. For example, many a time student come to us, and if I ask them what is your research topic, they're not very much clear. For example, the student says, I want to do a research on COVID. So doing a research on COVID is not your research title. This could be your research topic, this could be your research area, this could be your research subject, but the title is something different. Title is actually what you want to measure. Title is actually what you want to know about COVID-19. For example, your topic is, your area of research is COVID-19, but what you want to do, what is the exact statement to be executed, what is the exact statement in your mind to be explored. For example, you want to say clinical characteristics of COVID-19 patients. So these clinical characteristics of COVID-19 patient is actually your title. If I tell you clinical characteristics of COVID-19 patient, this clinical characteristics is actually a measurable. This measurable thing is very much explanatory, and everyone can understand what is your topic, what actually your topic, what actually you want to do, what your topic is telling about. So always try to take a very comprehensive and explanatory, self-explanatory, descriptive, descriptive type of title. Once you write your title, and I tell you, you are successful if someone asks you, okay, I understand your topic and I know what you want to do. If someone, after reading your topic, if someone says, what you want to do, it means there are some flaws in your title. No one should ask after reading your title about, no one should ask you what you want to do after reading your title. And many a times our students, our health professionals, our healthcare providers, our consultants are very much stuck with the selection of the title and the write-up of the title. So title must be feasible to do, and it must be in your research. If you want to start a title, I give you a tip. It must fulfill the finer criteria. In this finer, F mean feasible, I mean in your interest, N mean there must be a novelty, there must be ethical consideration, or it must be ethical to do, and it must be relevant to your field. I have experienced many a times, if a student come, usually students come to us, or to specifically to me, to show, they show their topic, and when I ask, is it related to your field? They say, no, this is not related to you, related to my field, but it is in my interest. So my dears, when you select your topic, when you select your title, it must be related to your field as well, if you want to get some credit from your institutes. So whenever you write your topic, you must see, is it meeting this finer criteria or not. Your topic must be feasible, interesting, novel, ethical to do, and relevant to your discipline. So then you, after completion of your research, you write abstract. Abstract must be written in 250 to 350 words. And when you are going to publish your article in any journal, I request you people, you just see the uniform requirement of the journals, the uniform requirements of the journals they have provided. Sometimes they ask you people to write your abstract in this structured form. Sometimes they say write your abstract without these headings. But always the content of abstracts are a few lines of introduction or background, then your main objective, then your results, then the conclusion, and then keywords. And this is very much important to read the uniform requirement of a journal in which you want to publish your research. So how to write introduction of your research? First of all, give general introduction of your topic. For example, you are working on clinical characteristics of COVID-19. Give general introduction of COVID-19, what it is, when it appears, when it is declared as epidemic, what are the what are the consequences of COVID-19 on health, on health and on the living human population. And then you can give epidemiology of any disease, risk factor of any disease, magnitude of the problem. Then by stating all these things, you slowly come to tell why this research is necessary to be done, why this research is being planned, why you have planned this research. This is called rational. Rational is actually what is the significant, what is the require, why you have designed your research, and what will be the significance of your research. So I just give you some tips. If you want to write any rational, first of all, identify the research gap. First of all, identify the area of deficiency in this research you want to do. Deficiency is actually where welcome back. I was talking about how to write your rational. First, identify the research gap, then start making your rational on the basis of gap identified. Then you need to have review of literature so that you can know the existing material, so that you can know about the existing literature, and using that existing literature, you can identify the research gap to justify your topic and to write your rational. Every time what we people make a mistake, we actually start writing the things without knowing what is existing, what is already known. This is one of very important tip, that you always have to you always have to find the literature first, then start writing, then justify your topic, then decide what to do. Usually we decide without knowing the things, and at the end we are very much we are very much disturbed when someone says that why you are doing, so a lot of work has already been done, what is the new thing to be done. So this is how we actually can justify our topic, if we do a very detailed and comprehensive literature review. Then you write your objective, and while writing your objective, we need to write primary objective first, then your secondary objective, and these objectives must meet a SMART criteria. Your research objective must meet a SMART criteria, in which your objective must be actually measurable, specific, assignable, relevant, and time bound or time based. I have my own criteria to assess your objective, or to know about the strength of your objective. This is actually based on my own name, Asif criteria. Your objectives must be advanced, scientific, implementable, and feasible to do. So keep my name in your mind while writing your objectives. Your objective must be advanced. Advanced mean you have identified these objectives through research gap. I'm very much focused on the research gap. That's why I'm relating everything with the research gap. Research gap is actually the thing that motivate you people to design your research project. So your objectives must be advanced, must be scientific, must be implementable. Many a times we do research, but later on we came to know that we cannot implement this in our setup. So this is actually the waste of sources in many terms, and many a times we spend a lot of sources, and later we came to know that this cannot be implemented. And after designing our research project, when we are halfway gone, we came to know that this research is not feasible to do. So these things must be in your mind while selecting your topic and while writing your objectives. First, you write your topic, go to the literature. After reading literature and after getting an in-depth idea from the literature, then finalize your objective and title and objective. After finalizing your title and objective, then write your introduction. Then make a good rationale. Then start your methodology. Start making your performa. Start gathering your data, collecting your data, and after doing all these things, then you will be able to execute and publish your research. Kindly, can you mute your mics, please? Then one of the major thing to write about your outcome variables, about your measurable things, about the things you want to explore. We call them operational definition. For example, again, I come to the core topic, clinical characteristics of COVID-19. Here you want to define three things. What actually is COVID-19? How it is diagnosed. Do not write dictionary definition. Never write the dictionary definition. Always write how it will be diagnosed. What criteria you will use to diagnose your disease. For example, you want to conduct a research on, let's suppose, on simple fever. You cannot write the operational definition of fever taken from the dictionary. You have to write how fever is diagnosed and what is the cutoff value to define a fever. For example, you will say it will be defined when a patient present with body temperature greater than, let's suppose, 99 Fahrenheit. So this is the exact criteria taken from the dictionary. You cannot write it as fever is diagnosed and what is the cutoff value to define this is not an operational definition. For example, you will say, so in COVID example, you have to tell how COVID is diagnosed. What actually you meant by clinical characteristics. For example, one of the clinical characteristics is, let's suppose, dry cough. You have to define your dry cough. Body aches. You have to define your body aches. High temperature. You have to define your high temperature. Then you can also give some definitions related to chest X-ray and radiological signs and symptoms. So define all these things in your operational definition, and many a times when you are working on the article, these operational definitions are part of your methodology, are part of your data collection procedure. But if you are making a proposal or synopsis, it comes before material and methods. So here operational definition keep the major definition, take the definition from your topic. For example, disease and outcome. I already told you. Let's suppose you want to define your pain, and it is defined as when a patient describe its feeling on visual analog scale and its pain is greater than 3. So you cannot say pain is a psychological and uh, emotional disturbance of the body. No, you cannot say like this. Operational definition must always be given in terms of measurability. Please turn off your videos and mute yourself, please. Wajid Ali Saab, please turn off your video and mute yourself. Okay, then in the section of material and method, the common headings are study design. If you are working on the current topic and you need to take data without any follow-up, or you are not taking data from the past, this is cross-sectional. If you are taking data from the past, this is retrospective. If you have planned something to be followed up, your study design might be cohort or prospective. If you are running a trial, you are testing few drugs, it may be clinical trial. So it depends on the objectives and situation of your data, of your plan. Are you taking data from the from now, or you taking from past, or you taking, or you will follow up in the future, or you testing drugs, or you assigning the treatment randomly? So study design always depend on your objective and topic setting, where you want to conduct this study, duration, how long you will take, or how much you took the duration to collect your data and to complete your research. Sample size, definitely you have to take, every time have to take help from a biostatistician or a person who is expert to calculate your sample size. Then sampling technique. Sampling technique means you may collect data on a random basis or on non-random basis. If you want to collect data on the basis of randomness, on the basis of some lottery method, on the basis of some computer generated number, on the basis of some random number, then you can choose simple random sampling. If you want to take every fifth, sixth, every nth number, then systematic sampling. If you want to compare two different setting or groups, cluster sampling. If you want to compare between two similar groups like male and female, stratified sampling. And if you do not want to involve randomness in your sample, then non-probability sampling can be used, like convenient sampling, what is convenient to you, purposive sampling, that is actually based on your inclusion and exclusion criteria, quota sampling, that is based on the preset proportion or number or percentage, snowball sampling, it is used in very rare diseases in which you get one sample from the previous sample. For example, you are working on a rare disease like, for example, muscular dystrophy. You will find one person having muscular dystrophy, and then you will ask that person, do you know anyone who can be part of our study? That person may give you the contact of another muscular dystrophy person. Then you ask that person, that may give you another person. So that's why it is called snowball. It's just like dropping the snow and making a ball. So among material and methods, your first heading was study design, then setting, then duration, then sample size, then sampling technique. After this, sample selection criteria, inclusion and exclusion criteria. Inclusion and exclusion criteria means which kind of people you will enroll in your research, and exclusion criteria mean which kind of people you will not take. And this is again from my own experience, 70 to 80% researchers do not actually know how to write inclusion and exclusion criteria. This is from the recent past. One student came to me. He wrote that all pregnant female will be taken, and in exclusion criteria, he wrote that male will not be taken. So when your criteria is based on the pregnancy, then why it is why you feel you will not take the male? So this is not actually the vice versa. Many a times we will say that children will be taken, and in exclusion criteria we say that adult will not be taken. So never write the reverse criteria. Always try to find the effect modifiers that can affect your outcome, that can disturb your research plan, that can actually modify your outcome or your criterias. For example, you want to compare two drugs in wound healing, and if in one group there are more diabetic than the other, that group may have delayed wound healing. So you know that diabetes mellitus is one of the factor that can delay the wound healing. So they must not be included in the research. In exclusion criteria, diabetic people must be taken as exclusion criteria so that you can have the pure outcome, so that this diabetes mellitus may not affect your outcome. Then you need to write your methodology. Among your methodology, you have to tell all the process. For example, I ask you, go and take the history of COVID-19 patient so that you can write their clinical characteristics. How you will approach the patient, which kind of questions you will ask, how you will measure the responses, and how will you actually define the outcome. All these things must be in your methodology. All these things must be covered in your methodology. For example, like here I told you define your procedures. If you ask someone, go and get something to eat, it is very much easy to get something to eat, but it is sometimes very much difficult the procedure how that person got that thing to eat. So always be very much clear about the procedure, always very much be clear about the outcome, always very much be clear how you measured the things. All these things must be taken in the methodology part. And special consideration if you have, for example, you are measuring in a project of, let's suppose, knee osteoarthritis, and you are saying that his knee is stiff. How and when you can say the knee is stiff? Is there any criteria? Yes. What is the criteria? You can say if there is a restriction flexion. What is the restriction flexion? For example, if you say that if the knee cannot flex more than 10 degree, this is the criteria. If you say if the knee cannot be flexed more than 10 degree, it will be called stiffness. So this is actually the operational definition as well I told you earlier. This is actually the operational definition I told you earlier. So this is again important to know about how and what the things to be included in methodology. I again tell you how you approach the patient, where you approach the patient, how you collect the data, what are the measurable thing in your data, and write those measurable criterias to measure the things in your methodology, which are also called operational definition I told you earlier. If there are outcome involved, tell how you say, for example, you want to compare success of treatment A and treatment B, efficacy of treatment A and treatment B. What is actually the success? When you will define this success? For example, the success will be defined if the body temperature is below 98 Fahrenheit. Let's suppose this was your success criteria. Or you say success will be defined when patient has pain less than 3 on visual analog scale. So always try to define it with some criterias. And all these criterias are available in literature, in research, and also these criteria can be generated using your own experience. For that, you need to check the validity and reliability of those instruments as well. Then we come towards statistical analysis. So first, in your research writing, first you need to write your abstract. For example, abstract usually is written at the end of the research, but I'm telling you in a chronological order: abstract, then introduction, then you need to review the literature to, for example, to fulfill the criteria of making your rational after identifying the research gap, then objectives, then hypothesis, if any, then material and methods. Among the material and methods, setting, study design, duration, setting, sample size, sampling criteria, yeah, sampling technique, sample selection criteria, inclusion and exclusion criteria, data collection procedure, then statistical analysis. Here I always encourage health researchers to learn these things or to get someone's help who is expert in analyzing the data or expert to guide you to select your statistical tools. Then definitely result chapter. Again, I request you to learn how to compile your result. Like for quantitative data, you always give mean and standard deviation. For categorical data, you always give frequency and percentages. Never calculate mean and standard deviation for qualitative data. For categorical data like gender, never calculate mean for gender. Never calculate mean for your efficacy, yes or no. When you have categorized your data, grouped your data, when you have make groups of your data, then never calculate mean, standard deviation, or median. Always go for appropriate charts or frequency and percentages. Then write your discussion. Discussion mean, if I talk in Urdu, behas mubahisa. I always encourage in your discussion there must be a discussion, and usually our chapter of discussion is free from the discussion. We mostly repeat our results. We mostly repeat the result of others. This is actually to compare your result and with others and give logics. If your and someone's results are same, why they are same? Why they are different? What were the differences of the methodologies? What were the differences of the criteria which were adopted? So always try to make a discussion, make an argument, make a critics, make statements about your research and others' research. So your discussion must be full of discussion. बहस मुबाहिसा होना चाहिए उसमें. Your discussion must not be free from the discussion. So the good idea to write your discussion is justify your findings with someone's findings, criticize yourself or to someone's findings. You may have discussion on the methods, you may have discussion on the findings, you may have discussion on the theories. So it depends on your objective. It depends on the way you actually defend your topic, your findings, your methodology, along with the national and international statistics. Then always conclude your findings. Never give results in the conclusion. Mostly students give results in the conclusion. So conclude what you actually tried to start, what you actually started, how you started, what you found, and conclude in a nutshell to make your reader for the better understanding of your whole project. And sometime reader says, in conclusion, nothing is written. He may need to read your whole article to understand what you have actually found, what you have actually concluded. So later you can give recommendation, and you may have limitation. You may write limitation of your research. So my dears, research should not be your fear. Research must be your passion, your interest, your actually part of your clinical side, your clinical practice. Explore the things. Tell the world what you have explored in your own nation, or in your own diseases, in your own patients. we actually always try to follow the standards set for the other nations. We say if this surgical method is good for another nation, it is good for us. No, it may not good for us. So you have to defend, or you have to justify your own findings with your evidence, with your data. Now, again, this word is going on 3D. What is 3D? Data directed decisions. Collect your data, make your own decisions. So, uh, so take research in your daily activities, and I appreciate if you start collecting your evidence, exploring your ideas, implementing your ideas after collecting data. If you start practicing, if you start practicing with evidence, you will get more success. You will get more fame. You will be known as a researcher, as a writer. So research is very simple. Select your topic. After selecting your topic, write your objectives, write your research question, jump into the literature, go into the literature, find the research gap, refine your objectives, refine your title, start writing your introduction, start writing your methodology, start collecting your data. After collection of data, make your own, make your own evidence, make your own statistics, discuss your statistics with others, conclude your statistics, and at the end, never forget to give the references from where you have taken the material. Always try to give credit of someone's theory with citation, because this is not fair to write something with your own name when it was published with someone else's name. So writing reference is another art. I suggest you people learn about reference citing softwares like EndNote, like Mendeley, like other BibTeX. There are many softwares which can help you to write your references in prescribed pattern and style. So I wish you very good luck, and I'm sorry I have to clear all these things in very limited time. If you have any question, it's over to you now. Please, you can ask question, and I will here to answer, inshallah. Dr. Aruj, are you here?
Sir, sir, thank you very
Yes, sir.
much, sir.
Sure.
Thank you very much for such an informative session. And I would like to thank you on behalf of all the participants of the webinar. And it's
Welcome.
for
Welcome.
very much, mashallah, informative session. Now, I would like to go for the question answer session, sir, because these are both telecasted on YouTube and Zoom. So I will just first read out questions from our chat box current from the Zoom. This is from Ashir Wasim. How many research questions should a research paper have?
Very simple tip. Every research question have every research question must be published as a single paper. There are no limitation, there are no requirement. If you have many research question, you can put in a single paper, or you can have multiple research papers. This is up to you, how you handle and tackle the things.
Okay, okay. Another question I've just received from the chat that if you can please explain, this is from Dr. Osama Nadeem. If you can please explain inclusion and exclusion criteria.
Inclusion criteria is actually is made from your target population that can be taken in your research, and exclusion criteria that can disturb your outcome, that can disturb or that can modify your outcome or criteria, that is called effect modifier. All effect modifiers or maybe confounder can be added in the exclusion criteria. You just keep that example of diabetes mellitus and wound healing in your mind and make the exclusion criteria.
Fine, fine. Thank you, sir. Another question is from Dr. Seema. What should be minimum sample size?
Or sample size never be minimized or maximized. It must be calculated for all the studies. If it is 20, I appreciate, go for the 20. If it is 200, collect the data from 200. It must be calculated. If you do not have previous literature on the topic, then you can do a pilot study. On the basis of your pilot study results, you can calculate your sample size.
Fine, sir. Another question from Ahmad Shazad. In order to write literature view from related articles, we select specific topic or it may be broad perspective. Like, what are the significance for this point?
Uh,
This is the
uh,
comment, I think.
again,
Fine.
this is up to you. Again, this is up to you. How much broadened topic you have taken, or how much how much with the simplicity you have executed it. It's up to you.
Fine. Another question, sir, from this is from Dr. Adil. Best and appropriate way to analyze data.
Uh, First, understand the type of your data. If it is quantitative, go for mean median and t-test. If it is categorical data, go for charts, percentages, and chi-square test. Depends on your objective. Depends on your objective. Next, please.
Fine, sir. Fine, sir. Thank you, sir. Almost done with the questions. I think, sir. Yes, this is from Rabia Mavish. So when we calculate sample size at 95% confidence level, then 5% is relative precision. Can we use 7% relative frequency at 99 confidence level?
Very good question. At 7% relative frequency, you always have to select less percentage, or at least half of the percentage of your level of significance or type 1 error or margin of error. Whatever the type of error or margin of error you take, you can take confidence level at your own choice, no problem. Actually, it is related to type 1 error and level of significance, not related to confidence level.
Fine, sir. Fine, sir. I think this is for enough. Aki, fine, sir. Thank you very much, sir. At the end, I think we will conclude. And if you people have any further queries, you can email our very wonderful coordinator, Dr. Wahid. He's been very active in some, as we have recently faced any certain technical issue. So you can email questions, and we will request Sir Asif to answer those queries also.
Yes,
I would
welcome
like
always.
to answer. I would like to thank you for your time, and you are always kind to us. You spare a lot of time in this work for the humanity. Mashallah, I'm really impressed, and hopefully the whole health professions and the participants of this session, they are also very much impressed, and they
Thank
have
you very much.
requested me to go for further sessions like data analysis and biostats related. So we would
Yes, why not? Yes,
request
why not?
you in future to
No problem. No problem.
please give your valuable time in this regard. And thank you very much, sir. Thank you
Thank
very
you very
much
much.
to our. I would like to thank again our worthy institution leads, Sir Professor Mugiz and Sir Professor Gilani. They are very kind, and they have always boosted us for doing such academic activities in the current time of even pandemic of Corona. Like, thank you, sir. I
Thank you
would
very
like
much,
to
sir.
end this
Thank you
session,
very much.
and I think there is email address they can the participants can share. Dr. V, they just write. The participants can share their name and email address to in order to get the e-certificates that will be shared by email to you. Thank you, sir. We
Thank you
would
very
like to
much. Thank
conclude
you.
this session. It's a wonderful,
Sure,
informative session, and we would like to see you have such informative and such related
inshallah.
sessions with you. Thank you, sir.
Inshallah.
Thank you, sir. Thank you
Thank
very
you.
much. Jazakallah. Jazakallah, sir. Thank you. We the, I can't hear you. Are you? Sorry. Yeah, sure, sure, sure. Thank you very much, Wahid. Thanks for your cooperation and thank you for resolving that technical issue. You can just gather all this stuff from here related to email and even queries also. So we can answer them later on and we can provide the certificates to the participants. Thank you. Thank you, Wahid. Jazakallah.